waiting for people to come into the room. Excellent. People are starting to arrive. Hi, Bart. Hi, Ivona. Hi, Lila. How are you? Sylvia, lovely to have you with us. Roswitha, how are you? It is great to be back. We were just saying before the call, I was actually for the first time at a conference yesterday, and I can't tell you, it's lovely to all be together in Zoom, but it is so much nicer to all be together in person. And so I'll say what I always say, which is it would be great if we were in a conference room in a hotel and we could all look forward to a glass of cava afterwards, but let's save that for Seville in March, April. And for anybody who's just joining us, as we wait for people to come in, Tad and Brian went over to Seville the week before last to just work out with the venues how things are going to be, how things are going. It's all looking very positive. The Andalusian Convention and Tourist Bureau are very positive. The hotel are so looking forward to seeing us, because this is the fourth time, the fourth time we've delayed it. And they're in that kind of space where they're just really excited about getting back to events. You know, it's like Irina, we were just saying, we were at, unfortunately Irina couldn't make it, but we had a board meeting in Dublin, and you know, the hotel was still under restrictions. There was no buffet breakfast, there was no room service, they were, you know, and all they could say was, we are so looking forward to doing what we do best, which is hospitality. And from the point of view of EuRA, we are so looking forward to one of the things we do best, which is seeing all of you in person at the conference. We just cannot wait. So today we're just...
I just booked my room. I just booked my room last week, and it felt so much better suddenly.
Thank you for saying that, actually, because again, I meant to say that, yeah, the room bookings are now open on the website. If you're holding a credit note for 2020, then please go ahead and book your room. This is great. Thank you so much to everybody who's come in. We've got 65 people signed up for today. I know that many people watch these now on LinkedIn and on YouTube, but for those of you who are here live, it's great to have you with us with our fantastic panel today for a Mobility Update Europe. So I would love you to be introduced to, first of all, Irina Yakimenko from Intermark. Irina, you're sitting in Moscow today, right?
Yeah, correct.
Intermark cover Russia, Eastern Europe. Jenny Hogan, wonderful to have you with us. Coppergate Global, a division of National Corporate Housing. For those of you who don't know, Jenny has changed identity, which is fantastic news. Congratulations, Jenny.
Thank you.
That's great. Pauline Sun, Expat Management Group. You're in Amsterdam today, correct? Yep. Working.
Yes, I'm in Amsterdam, and we have an office in Brussels, but I'm in Amsterdam.
Yeah, working across Benelux. Great to have you with us. Thank you so much for joining us. Lovely to see you, Pauline. And Patricia Mazzara, thank you so much to you for stepping in. It's Patricia from Principal Relocation in Italy. It's great to see you. I can't believe it's been so long since I've seen any of you in real life. But it will happen again.
Thank you for having me.
It's a pleasure. Thank you for being with us. So again, like I said, to everybody who's watching, this is being recorded. It will be on YouTube next week. If you have a question or a comment to make at any time, please go right ahead and put it in the chat box. Strange quirk of Zoom. The default is the question will go to the host and the panelists. If you'd like it to go to everyone, just click on the arrow and just go down to the Everyone tab, and that will allow your message to be seen by everybody. You can also put a question in the Q&A, and I'll keep an eye on both all the way through. So again, if you've got something interesting to say about the state of where we are at the moment in Europe, or the state of mobility, then I would love to bring that into the conversation, or wherever you are. So for example, Sylvia in the US. I am going to start, if it's okay, Irina, with you. Things are a little bit different in Russia today.
Yeah, it's interesting. If we were having this summit just 2 weeks ago, the whole speech of mine would be completely different. But as we were preparing for just before the session started, I was telling Dom that I'm super committed, to balance the good and bad, because now it's so easy to go into the bed, and how horrible things are. And especially now in Russia, end of last week, we sort of entered a lockdown, the first lockdown from after last year. Sure. So for a long time, it's been way back to normal until things were getting worse and worse. though, the good thing, it's hard to find the good thing about COVID in Russia. But no, I've got one. The good thing is that there is a vaccine that is widely available to everyone, literally to everyone across the country. And all you have to do is just make it's available truly in every supermarket. So it's that easy to get it. The even worse though thing is that at the moment Russia is just at 33% of people actually vaccinated, which makes it 96th place in the world, which I personally find super ridiculous and very, very sad. So very briefly, yes, Russia is in the lockdown, so pretty much nothing works. All the restaurants and everything is closed, but all the public transportation is open. And the bad thing is there's absolutely no distinction whether you're vaccinated or non-vaccinated at the moment. And obviously that's not helping at all to get people vaccinated. The ridiculous part is that the only two things open besides the grocery stores are museums and theaters, providing they limit the capacity to 50% and they request for QR code. They're not accepting PCR tests, just QR code. It all sounds nice, but the question, why people can go to the restaurant with a QR, or why people can go to the museum with a QR code and not to their office, or not to the restaurant. So for us as an employer, obviously that's always hard. We're lucky and proud to have a fantastic team that does everything they can working remotely. But we all now know as never before, it's not the same, and it's hard and it's difficult. So that's in terms of Russia. And in terms of other CIS countries, they're pretty much in the same shape, with the only, I think I will mention just two exceptions. One is Ukraine, which is a bit different. There is all the vaccines are available there, whereas in Russia it's just Sputnik that is available, which is another challenge, and maybe we'll talk about it afterwards. But in Ukraine, you could have all the vaccines. They are present, but they're very hard to get. So they're not very available, making just 18% of people vaccinated. So they are, but I thought that they did the smart thing is they've started what they call the adaptive quarantine regime, that things are closed, but if you have a PCR, if you have either a negative PCR test or QR code with the vaccination certificate, you can access them. And the third one, which I found was very interesting, is Kazakhstan, a country maybe not many of you worked with, but for us, it's the second biggest volume after Russia, obviously. But Kazakhstan has vaccines quite widely available. At the moment, they're at 43% people being vaccinated, and they're in a fairly sort of open state. So it was just they're non-typical in the CIS region.
It's so interesting because, again, like you say, that the low take up for the vaccine in Russia, which is extraordinary. I mean, as you say, that is low, and not requiring people to use the QR codes is not helping that situation, right?
It's not at all, at some point they did enforce that, and requiring restaurants to ask for, and hotels to ask for a QR code, but apparently there was I don't know what happened there. They kept it for 2 weeks, and in those 2 weeks was the major spike, in people getting vaccinated. But obviously there is a lot of unhappy people with that happening. And obviously I don't want to get way too political here, but you need to manage things and manage the emotions, I guess. But my hope is that there should be something in works within the government to differentiate whether you're vaccinated or not, because otherwise it's hard to. Apparently, it's effectively the vaccination's been failed. People don't get vaccinated. So I think the only way then is to push them to do that.
It certainly worked in Ireland when we were in Dublin for the board meeting. That was the case. That was the single primary reason for the 92% rate of vaccination that they have in the country, was that, that's your access to life again. Irina, thanks so much. We'll come back and we'll talk again in a minute. Jenny, can I come to you, because it's kind of a polar opposite set of things to say.
I was going to say, completely in contrast to what Irina's just said. The UK is pretty much open for business as usual. There are very little restrictions. We don't have to wear masks. It's not compulsory anymore. Apart from public transport and sort of medical facilities, you really have to wear masks. Everything, everywhere else, supermarkets, restaurants, wherever, it's up to you if you want to wear masks. And I would say, I don't know whether you'd agree, Dom, that the majority of people I see don't wear masks. So I think from a personal point of view, I do keep socially distanced as much as I can, but I don't wear a mask in a supermarket or anything like that. Some venues will ask for COVID passes, theatres, etc. But again, you don't need them for going into restaurants or pubs or anything like that. I think the biggest thing that has changed for us over the last, since Monday, the main thing is that our travel restrictions have been lifted in terms of, from a mobility point of view, people coming to the UK. There's no longer the traffic light system in place, and all of the countries have been removed from the red list. So as long as you're fully vaccinated, and there's a slight caveat here, the rules are slightly different in Wales, Scotland and Northern Ireland to England. They have little twists of their own, but as long as you're fully vaccinated, you can come into the UK. You just have to complete a passenger locator form and do a day 2 test, which is no longer a PCR test. It can be a lateral flow test. There's no quarantine, etc. If you're not vaccinated, then you have to still quarantine for 10 days, but there's no compulsive, no government hotels, quarantine hotels or anything like that. I did do a little bit of research and just looked up quickly what our rates were like in the UK with regards to COVID, and 80% of the population has had 2 vaccines, and they're now rolling out the booster program. So if you had your vaccine more than 6 months ago, you'll now be offered a booster. And I thought I'd written, 8.5 million so far have had their booster shot, so they've had their 3rd vaccine. As of yesterday, we had about 40,000 cases a day, new COVID cases, which sounds high, but actually it only translates into hospital admissions of about 900 a day, and the daily death rate is around 217, I think it was yesterday. Now, 217 sounds high, but probably not in terms of the population. And also those are for people that tested positive for COVID within the last 28 days. So they may not have died of COVID, but with COVID. So there's a sort of slight caveat there as well. And we're now offering jabs to 12 to 16-year-olds in the UK, which school children. I mean, I think our cases sound quite high, but I think they tend to be in the younger age groups where now they've gone back to school, they're not in bubbles, they don't have to wear masks, etc. So I think that's probably where it sort of bumped up the cases slightly. But generally speaking, it's all sort of feels fairly normal, I would say. And we mentioned before we came on the call, it's not sort of rammed down your throat the moment you turn the news on. The top news story isn't COVID anymore. So, you know, unless there's a new piece of research came out, or because our cases are quite high, and we're going into winter, they're starting to talk about a plan B where they may reintroduce masks, they may have working from home restrictions, but nothing that's not come into effect. It's sort of talk at the moment.
Yeah, it's very interesting. Thank you so much, Jenny. I mean, it's like you say, the news has shifted.
Yeah.
I think, but then there have been so many other things going on. We had no,
Yeah.
we couldn't go out because of lockdown, and then there's COP26, and then we couldn't go out because no one had any petrol in their cars. That was a shocker. And yeah, there's definitely things happening about. I don't know how you feel about that, but certainly it was interesting you saying about the masks. Being down in London yesterday, I did notice very few people were wearing masks. Not so much actually on public transport, that was okay, but up here, you know, living 2 hours out of London in a much more rural area, most people are still wearing masks. It's a funny balance, isn't it? Pauline, can I come to you next? It's great to see you, and I'm really glad to catch up with you as well, because again, you know, I'm not so sure. I know that the Netherlands went through a spike. How are you doing now?
Yeah, we did fantastic, actually. we even didn't have to do the 1.5 meter distance anymore. We were not wearing face masks, only in public transport, inside, and in hospitals, as Jenny also explained. For the rest, we were fine. The restaurants and the terraces and the bars, they were all open till 12 at night, free to go. But now, last Tuesday, 2 days ago, it was announced that new measurements need to be taken. So from the 6th of November, which is going to be this weekend, we will need to wear masks again in the shops. We need to show the COVID pass in a lot of places. So if we want to enter the gym, for example, we need to show the COVID pass. If we want to enter a restaurant, we need to show it. So a lot has to do with that, with the vaccinations. The mask is quite okay, I think. It's reasonable. It's in crowded places, people are too close. But for the rest, if we have our vaccinations, I think about 85% of the Dutch population has been vaccinated. So big difference with the Irina's story. And then the other ones that are, prefer not to do it, they're quite strict. We have quite some protests in the Netherlands for all these regulations. So people really speak up against it. But you see a lot of people now made appointments now that they have to do it anyway. So suddenly it changes a little bit. So that's a good solution. Yeah, so I think at the moment, we even had our Formula One races in summer, and it was a big party. Everybody was there in orange again, so we could do that. So it was a big relief, and now we need to kind of take it more seriously and take the measurements. But it's okay. It's not too bad, and let's see if that results in something.
That's really
so
interesting.
The entire concern is the emergency care in the hospitals. That if people end up in those beds, that they take the place from other people who need other emergency care, and that we don't have enough staff. There's really enough staff in the hospitals, and also people who need other important operations. Of course, they now need to wait because of the people that get COVID. I'm not sure, but a lot of information is shared. I'm not sure about the percentage, but the majority of people living in the intensive care are the ones without the vaccinations. So probably that's true. And yeah, so that's what they're very careful about at the moment. Yeah.
And rightly so. I mean, it is again, I was just reading an article this morning about, all the people in the hospitals and the intensive care units are exhausted. They've been dealing with this now for 20 months. So
yeah, a lot of people, they call in sick. They are overworked. There's really a shortage of staff in the hospitals. Actually, in fact, the entire Netherlands, there's never been, the economy is doing great, and there's never been so much unemployment in the Netherlands ever before. So we really need people.
Yeah.
Also, maybe a part is because people that used to work in the Netherlands moved back home. People from Poland, for example, they moved back home. So we miss a lot of people in the Netherlands. But especially the main concern, of course, is the medical care at the moment.
And how did people take to the introduction of restrictions again, having to use the QR codes to enter? Did that go okay, or the people accepted that?
Well, the opinion is quite strong in the Netherlands that people don't want to do it anymore. For example, on Tuesday we had this announcement that they also wanted to ask kids who do outdoor sports like soccer or hockey games, which is very popular in the Netherlands, and that the kids needed to show a COVID pass, but also the parents who were watching the competition, which is outdoor. And then everybody started to protest, including those sports clubs. And actually, they managed to change this rule, so that's not going to be applicable anymore. But there was a lot of protests after the announcement. It was in some cities, people were in the streets, but it's especially, I think, a younger group who like to go out. They want to go to nightclubs. They want to pick up their normal life, but the more mature group of people who are working, they don't mind that much. We are recommended to work half from work, so half in the offices and half of the time from home. And I think everybody appreciates that rule, because we all like back into the office. We all started appreciating working more from home. So that's a very reasonable rule. And so I think most of the people in the Netherlands are fine with it, and we know we just have to do this. We're still happy. Actually, we were happy. The Netherlands itself is red already again, the entire country, and like 1/5 of the country is dark red. So that might result in that other countries maybe feel it will be less secure. At the moment, we still have, I think, like in most countries, we have the 10 days quarantine regulation if you enter the country. But if you get tested after 5 days and your test is negative, then you can stop with your quarantine period. And this is only applicable for some countries worldwide. There are a lot of countries who don't need to do that anymore, depending on, of course, their local situation. Yeah.
Thank you very much, Pauline. It's just fascinating, the diversity of how this is playing out. And I mean, Patricia, thank you. So it's great to see you, and thank you for being here. Just again, from the point of view of what's happening in Italy, I know, Italy and France had, some opposition to the use of the QR codes. How are things with you now?
I think with the mandatory requirement of the QR codes, just to get around, go to public offices, hospitals, especially, even certain restaurants, depending on, some ask, some don't, unfortunately. But there has been a spike in vaccinations, which is good. In fact, Italy, I think we're registered, I wrote it down, at 86%. So that's good. But yeah, 86%. However, in that the mandatory QR code to kind of get around, some people feel, well, it's not fair, you're limiting my life and all that. So some people just took it as, okay, I have to get away from the fear of needles and just go. And some people have just been like, no, this is removing my liberties, as we say. We don't want to get into politics, of course, but complete cycle of vaccination of that, let's say, population of 86%, they're at 83. So that's really good. That's 12 and above, of course.
That's much higher.
So now they're talking about, of course, the third dose. That booster will be, let's say, they're going to do it just like the normal vaccine that they kind of did. First, the fragile public workers, health workers, all of those. So they're working on that now, and over 60.
Yep.
So they're about at 32% with that being done. So we'll see when, my QR code still says I have 12 months from when I got my last shot.
Okay.
So we'll see where that will come for that booster shot. Italy has, again, that kind of different, kind of reality, because of the fact that there are people that just say, like myself, I want to do it for me, for myself, for my family. I want to make sure it's done. Some people are just, technology is not their friend. So it's like, oh my God, I have to go print it out. I don't have, the possibility of digital. So for the elderly, it's quite a different view, let's say. In terms of, let's say, life, it seems to be getting back to normal, even though last night they were talking about, let's say, increase in infection. So increase in people testing positive. Could be the weather, season, all of that fun stuff. We don't know. But let's hope it doesn't lead to other things. Italy is trying to be business as usual. So we're trying to get there. Like they have opened, so masks are worn inside, businesses, grocery stores, wherever you're indoors, you're required to wear a mask. Outdoors is not required unless there's not social distancing. So if there's any kind of gathering where there's social distancing, the mask should be worn or needs to be worn. Whether they do that is another story again, but those are the directions. In terms of businesses and the QR code, that's where kind of the uproar was, because the government imposed that anybody that is working, even remotely, needs to have a QR code, needs to have that green pass. So, a lot of people were saying, well, if I'm working from home, why do I need the green pass? So it's a lot of politics in there, in the whole situation. In terms of, let's say, schools, at the moment, they're still trying to understand how to give it a national direction. Right now, each school district is managing kind of, if there's any cases, whether to, have the class quarantine, anything like that. So it's been interesting to hear how, if one child has been tested positive, then the entire, or that school or that classroom or that school is at home, but still doing, remote schooling. So that's good, at least. In terms of, let's say, getting back to entertainment, that is, again, you have your QR code, you can go to museums, theaters, things like that. They do limit the capacity, so it's not full capacity. So life is getting slowly back to normal, hopefully.
Irina, please go right ahead. Yeah, you wanted to ask a question.
Yeah, Patricia, you mentioned that people need to have the green pass, right, to work, even they're working remotely and from home. Is there any liability or requirement for the employer to check that? And if their employees don't have that, do they have to do anything, and do they have the legal rights to do anything?
They have the legal right because the government did impose that green passes need to be provided by every employee. So who does not have a green pass is not working currently.
Oh.
Yeah.
Wow.
They don't lose their job. They don't lose their job, but they are not working. So obviously it's an incentive, of course, to make sure that, you know, everybody is safe. Employers do need to check. So once that, we even did it here, once that restriction came, once that requirement came about, you know, Gianluca immediately, there's an actual app for employers to then go ahead and verify each individual green pass. So yeah.
I want that rule in Russia.
It works. It works. You know, as Pauline was saying, you know, there has been quite a lot of uproar and, you know, manifesting their, let's say, you know, not believing in the green pass, but it has worked to try to get ourselves back to life.
It's interesting because in Russia, for example, there is a requirement for us as an employer to sort of ensure that up to 80% of our people are vaccinated. But then there is no, we as an employer have no legal rights to do anything, to push our employees to get vaccinated. We cannot obviously fire them because that would be illegal. So it's
definitely a kind of sticky situation, because I understand where people are coming from, saying, you know, like, it's my, you know, I don't know what this vaccine will bring to me, to my body, but I also understand we all need to be safe. You know, millions and millions of people have taken one type of vaccine. We should be able to kind of limit that, you know, fear in a lot of people, to incentivize them to actually take it.
Thank you so much to both of you for bringing that up, because that is fascinating. And Irina, before we got on the call, we were talking about the fact that, again, you know, Russia has said that this lockdown is paid holiday, and that burden falls on you, correct, as the employer?
Right, correct. Yeah.
That's a very
and basically the only people who are allowed to work are those who either have special well, state permission, or those who arrange for the salaries to be paid. You know, the only thing that must be the only thing that must go on is people must be paid. And now we just, the puzzle is where do, anyways.
It is absolutely fascinating. Irina, can I stick with you? So, I mean, how are things now across your network in terms of, I'm imagining fairly diverse in terms of where mobility is starting, which parts of your operations are getting back to a level of normality? How are things?
Yeah, well, that's sort of the good part of the conversation, because in that respect, you know, for, well, 2021 for us in general, for mobility, we can say that things went back to normal, as closely to normal as we can get.
Wow.
So across the board, and we are in all of our countries, we have immigration, our own internal immigration teams, household goods teams, and DSP teams, relocation teams. Of course, this pandemic once again proved, you know, the value of diversification. Having 10 different countries and 3 different service lines really helped us, you know, keep going. Because when last year, especially when relocation literally on all the DSP work went to nothing, but immigration and household goods, with household goods, no borders ever were closed for household goods moves. But so immigration, household goods did really, really well across the board, and then supported all of the locations. Now this year, even if we look in Russia, for example, if we look at the official stats by immigration offices, this year they've issued the highly qualified work permits, the ones that typically our experts would use. They issued 30% more than they did in 2019. So it's big time sort of pre-COVID. And we see that in immigration. In terms of relocation, we've hit the pre-COVID levels. We did not we did not grow more in terms of the number of relocations. But now we are, well, literally this week, we are seeing things getting a little bit slowing down. Either it's just our high season, which is gone, and we're just going to the slower season traditionally, or this is the impact of the lockdown and generally people thinking, well, it's gonna be prolonged or not, and holding the moves that they wouldn't have otherwise. But it's you can't tell, right? It's one or the other. So in terms of business and mobility, that's the positive things. But really, there are a lot of positive things business-wise that are going on. In terms of the trends, for example, in Russia, we are suddenly seeing a lot of Russian companies who have learned to do relocation in a more organized way. If previously they would do what we now call, and we're calling the lump sum, right? Or they just didn't care about how their people are moving. But now a lot of them introduced their relocation packages. So we're doing a lot of domestic relocations, like proper relocations. We're doing a lot of outbound relocations that was literally unheard of 3 years ago. So that's an interesting and a big change for us.
That's fascinating, and that raises a really interesting point, because actually I had a meeting yesterday about duty of care and how COVID is altering the landscape of duty of care in terms of mobility, in terms of things like lump sum. I mean, this is not a hand-holding solution when there's a crisis like this. It's not going to work.
Yeah, it's interesting, that as we are hiring a lot at the moment, and as we're speaking to a lot of our clients, I think what also COVID has brought is a different perception of how, especially the newer generation, how they see work. Exactly as I think Pauline mentioned, that now more and more that we get to appreciate work from home as never before. But what we are literally seeing regularly is that new hires are saying, I would like to work from home 100%. I don't want to go to the office. I don't need to meet my colleagues. And that's, for us, is like, well, but we can do that, we can do that. Maybe there are obviously there are industries that would work, but not in our industry. And obviously, I mean, it's so clear how pandemic has affected team relationships, no matter how close they were and how long people knew each other, and they could be friends, but it's so different now. I cannot believe that it's that much of an impact, as I think that we could not have anticipated this huge of an impact to the people's relationships.
Yeah, we keep saying this, we're a very small team. Pauline, please.
Well, I was just going to mention, because what I think the good thing about it is that in the Netherlands people like to work part-time, that we have a small percentage that wants to work 5 days per week. But I see now more mothers actually who used to work 3 days per week or 2.5, and they said, "Oh, I'll work 4 because I can work 2 days from home anyway." So, and that's a positive thing. People are willing to work more because they can easier combine it with their private life, with their kids going from school, and still are very active. They are very productive, I think, working from home.
I mean, I
Yeah.
think
That's a good thing.
Yeah. It's a
I
long
think in the UK, there's certainly a move towards hybrid working. I don't think people necessarily want to work full time from home, maybe 2 days a week in the office and 3 days at home. And I think it's quite important if you're joining a new team that you actually get to meet the team face to face and socialise with them. So a lot of the assignees that we're working with, location is much more flexible in terms of they don't have to go into the office 5 days a week. So they're perhaps prepared to travel a little bit longer for the 2 days that they are going into the office or something like that. So that's been a slight sort of change. The other thing I wanted to bring up on here, and I don't know whether you've noticed it, have you noticed that more people are bringing pets, are travelling with pets? Oh my God, it's such a headache in the UK. Oh,
Maybe that's the British thing.
Everybody's having pets.
Yeah, I call them COVID pets. And they're not just, used to be families with like a dog or something. And it would be like, okay, yeah, I'm sure we can get a family house that's pet friendly. Now it's singles. Yeah. Wow. Now it's singles, couples, couple of cats, And it is a bit of a nightmare because our rental system in the UK isn't particularly pet friendly.
No.
Same in the Netherlands.
Not at all.
So, yeah.
I think that's a true COVID impact. Previously when you were traveling, you could not think of pets. And there I am for a year stuck at home. Why not?
Yeah.
Exactly.
Jenny, that's really interesting. I mean, and again, so from your point of view, Jenny, I mean, what are you seeing in terms of mobility? I mean, I know we've spoken fairly recently, and things have climbed back, fairly in a fairly steady way in the UK. How are things for you now?
Yeah. I think that when we started opening up in the spring, it got very busy from the spring, summer into the early autumn. It's slowed down a bit now. I think, but then that's traditionally this sort of time of year. We're getting lots of inquiries for pricing from partners who are bidding for work, which is always a good sign, because hopefully going forward into 2022, then that work will come into play. But it's slowed down a little bit now, but as I said, that's normal for the time of year. I think there was a lot of pent-up demand. I think there was a backlog within the industry, within our industry. So once the borders started opening and it was easier to move around, then we definitely saw it here. The problem in the UK that we're experiencing at the moment, and it's UK-wide, is that 12 months ago, it was very much a tenant market. So our clients, you could go, you had a choice of properties, you were in the driving seat. It's done a complete 360. There is such a shortage of properties now brought on by the pandemic. And now it's completely a landlord's market. So we're having to really manage expectations for assignees coming over. They won't have the pick of the bunch of properties. There is a real shortfall. Demand is so much higher than the property that are available. And, agents can't get properties on their websites half the time, and they've been let. We'll put a program together and we'll think, oh, that's a really good program. We've got 10, 12 properties or whatever. By the time you actually go out, and we've only confirmed the program the day before, half of them have been let before we've even got to see them. Wow. So it is quite crazy at the moment. I think there's a number of reasons. During the pandemic, people tended to renew their tenancies, so they didn't move because of the uncertainty of what was going on. People had perhaps moved out of cities and now thinking, actually, that life's not for me. I quite like the city. So they're moving back into the life sort of style that they had. And another thing is that a lot of our landlords have left the market. We had the stamp duty tax break, which is like the purchase tax in the UK. So during COVID, there was a stamp duty holiday. So you didn't have to pay a buyer's tax, basically. So that really rebooted the property market. A lot of landlords sold their houses at that time. They might have been reluctant landlords in the first place, but so the stock of housing has reduced, and also the tax breaks there. There's more legislation around landlords now, and it's perhaps not such an attractive proposition as it used to be for them to be a landlord. So, you know, all in all, it's been a bit yeah, we're finding that we're spending much more time on research than perhaps the face-to-face time with the client, because we're having to just dig much deeper to find the properties to show them. And sometimes even we've said to clients, right, you need to get in and see this property. Can you go on your own? You know, we've taken them out and perhaps something's come up and we'll say, look, I booked you an appointment for 3 o'clock this afternoon because I can't get a consultant to you to take you. And you need to get in there, just because the market's so crazy.
Incredible. That is crazy.
It'd be interesting to hear if it's like that in the rest of Europe.
I was just going to say.
It's exactly. You can take all Jenny's words and apply them 100% to the Moscow market. It's exactly the same.
Yeah.
And Pauline, is that the same for you? I mean, obviously resonating as well.
Yeah, and it also affects the way you deliver the program, because in the past you could schedule a full day viewings, so you can put them in a sequence and you have a very productive day. But now you need to jump back and forward and instantly respond to whatever comes on the market. And so sometimes we have that too, that unfortunately a consultant can't be available that quickly. But we do encourage the transferee then to go and visit that property. Because otherwise it will be gone again. In the Netherlands, we have a big problem with temp housing at the moment. So we usually where you would stay for a month and then from there look for your permanent property. There's such a shortage of temporary accommodation, and then also because the normal rental market is very tense, people might need to extend, and what we experience at the moment, that it's very hard to get the extensions, because then we booked for a month up front, and then after 3.5 weeks we find out, okay, it's not going to work, we need another 2 weeks, for example, on behalf of our client, and then they either need to kind of move out of that accommodation, move to something else, or maybe even have to move out of the city because everything is fully booked. So then suddenly they end up in the countryside and need a rental car to be able to commute to work, etc. So we need to find creative solutions, but it's hard to manage those expectations, because if you arrive, you want to be in a stable position and from there find your new home. And if you don't have to kind of move in between, sometimes we even have to fill up gaps that they can stay 1 week in there, then they need to move already for 3 weeks to the other place. And there's no way we can avoid that, because there's really a shortage of housing. What we see in the Netherlands from the beginning of summer, it's crazy in the Netherlands. So many people are coming in, and I think, well, the Netherlands especially, because we kind of try to promote ourselves as a tech hub. I think a lot of IT guys, tech people are coming, that gives a lot of pressure also on the banks to open a bank account, but also the town halls for the personal registration, the immigration offices to kind of set that up. We have long waiting lists, so normally they would be able, within the first 5 days after arrival, they would have their appointment. Easily they need to wait now for 6 weeks before they get an appointment. So we are really discussing that with the government and with the banks, etc., to kind of forward those appointments. Because I mean, if you don't have your social security number and if you don't have your bank account, we have a problem with payroll. You know, because there are also some companies who really want to have them a Dutch bank account to be able to put the salary on. So yeah, those are puzzles that we need to kind of figure out, and that is a big part of our work at the moment to make sure we get all those appointments in time, which before COVID was not an issue at all. It was all easy. There was enough staff. There were enough appointments, and so it's yeah, it's been very, very busy that way. And yeah, that's what I wanted to. But what we also see is yeah, a lot of recruiters. We have we need a lot of recruiters, a lot of tech people. Actually, for us, I mean, it's quite hectic, but we've grown with the double size of staff since before COVID. Yeah,
Great.
so we had a tense period in the beginning, like, oh, what's going to happen? And then at some point it was crazy, and we even sometimes we have to do work temporarily from other relocation companies because they're also overloaded. So we pick up a part of their work, but we're doubled in staff. So yeah, it's actually the company is doing really great, and Dutch economy is also doing really great at the moment. Of course, some industries like the cultural institutes and the restaurants, they're still not up to level, but the international corporations that we of course now talk about in our with this about mobility, its economy is doing really well. Yeah, it's and it's hard to get staff in general. That's what I also wanted to tell you, that there's never been so little unemployment in the Netherlands since I recall. So everybody is trying to find staff, and if I look also colleagues of ours or like competition colleagues, or how you want to call it, everybody is looking for relocation consultants, for immigration consultants, but also in other businesses. There's really a lack of people to fill up all the jobs in the Netherlands.
Yeah, I think that's a.
But we kind of, yeah, we need to kind of get into a new balance, and we're not there yet. There's a lot of pressure. There's a lot of, although once you arrive as an international here, the living conditions are fine here. I mean, it's not that bad with COVID, but for them it's quite stressful in the beginning to start up, to get that they have their appointments in time, that they find their house. They need to move very quickly. Quite high rental prices because you can't negotiate the price at the moment. Also because, I mean, not really because of the lack of housing because of the internationals, but because a lot of Dutch people want to rent the same properties because the purchase price is so sky high at the moment in the Netherlands that people can't get a mortgage high enough to finance a house to buy. So they stick in renting properties, and that has also some effect for internationals moving to the Netherlands because there are less houses available because of that in the little bit lower price range.
Yeah, these are huge issues across the industry, and I mean, and not just affecting our industry, but I think what's so interesting about what you're all saying is, you know, it's fantastic to see the growth that's come back into mobility, but actually being able to facilitate it has never been more difficult. That must be incredibly
hard. I think for all of us, it's really hard work at the moment.
You're nodding again. Is this resonating with you too?
The Italian housing market has always been a landlord's market in general, but in those cities, this is now starting that in those, let's say, on-demand cities like Milan, like Bologna, you have landlords that are like, this is my market. Like now, you know, prices are rising. You have, you know, less and less inventory because there's so many people coming in that it is difficult. You're juggling trying to set an appointment, keep an appointment, and let them see that house. So it's just one of those things you're constantly struggling to put all those pieces together, make sure that the customer, you know, has that appointment, and that, you know, let's say the schedule stays the way it is. We have been doing that kind of creative thinking of saying, okay, they went to see 2 houses today, tomorrow we can only see it at this time, nobody else is available, the customer will go, we'll call them on the phone, we'll walk them through everything, because it's just one of those things that if they don't catch it at that moment, they'll lose it. They won't have anything. In the, let's say, other cities, lesser demand cities, let's say the market has not increased in terms of pricing, but again, that inventory has shifted in terms of the availability, because so many people that were possibly working abroad or working in other cities decided, well, I'm going to stay home, I'm going to stay in my own city and work from home. And so the market has changed quite a bit, that inventory is less and less and less, and customers expecting, 10, maybe 12 properties are seeing, 6 or 7 properties. And it's just like, oh no, what do you do? So you're looking at, let me contact these landlords that are selling and see if they're interested in renting, let me go see if this temporary solution or short-term solution would be willing to do a long-term solution, those kind of creative thinking, just to try to get as much as you can for that customer. It's just one of those things that you're like, I've never seen it so complicated in getting just a program out. But I think that it's just part of, that relocation challenge that we all love, all of us in this chat and who's watching, it's just part of the, the day-to-day challenge that is relocation in general that we love. In terms of appointments, I mean, public offices in Italy we all know, take a very long time to do certain things, to set appointments and stuff like that. That has not changed. COVID has caused certain cities to be quite delayed. Milan being one of them, which is, our leader in terms of city on demand, but we still try to, get as much as we can for the customers, set those appointments as early as we can, just to make sure that they're not waiting and waiting and waiting. So it has been a lot of creative thinking from all of us to see what we can do to make sure that we can help them as fast as possible, as simple as possible for them.
It's, I mean, again, it is testament to this industry's creativity and resourcefulness, and to all of you that, that you have to come up with that kind of thing, because like I say, the demand has come back. The demand has never been bigger, but there is just, these issues we're hearing from everybody. I tell you what, there's going to be a lot of conversations about this in Seville. I mean, it's just,
I'm sure.
The only time that I heard people really pre-COVID having the conversation that you've all just said was our members in Geneva, who would always say, you've got a 2-hour window to take this property. That was the only place in Europe where that was such a reality. If anybody has any questions or comments they'd like to put in the chat box, we're approaching the hour, so I will draw this to a close. Does anybody have anything they'd like to add? Pauline?
I would like to add, one thing. What I find very interesting, because those young IT guys that I mentioned, which we have a shortage of in the Netherlands, actually make our business grow for all relocation providers, because it's hard for corporate to kind of hire the right people. So they much more realize that they really need to look after them. Like before COVID, quite often they said to those youngsters like, you arrange your own housing and you're capable of doing your own registration. They treat them much better now, because they want to be a good employer and make sure that they have no retention, that they stay with them, because they otherwise might just switch to another corporate. So the demand for relocation assistance has increased because of the shortage in that profile of working people. I found it interesting. I would not have thought about it that it would happen, but it's a very logical thing. Yeah,
there's a definite. Funny enough, I was having that conversation with a couple of people yesterday who are putting together a fantastic duty of care module for us for the academy, and saying the same thing. Talent retention is now not just a thing that gets tacked onto the end of something. It is really key when you're not.
It's crucial. It's crucial because people, they have choice. They can work everywhere.
Yeah.
You know, so yeah.
We're seeing more and more, you know, companies, just local companies, even though they're part of multinationals, that are coming to us to say, you know, what can we do? What can we do for this person? We want this person. We want to keep this person. We want to hire this person.
Yeah.
You know, what is the creative thinking that we can do to get this in terms of immigration, in terms of whatever kind of package to incentivize that person to come, to stay, to live.
Yeah.
So we've seen that more post-COVID than pre-COVID.
Yeah, it increases our role, I think.
Yeah.
Yeah, nice.
I think in addition to people retaining all the staff, another thing that will be a huge focus for everyone is hiring and finding the right staff.
Yeah.
It's interesting that Pauline said that you doubled in size. We grew as a team a lot, and we now have like 25 people, we're looking for. And as our HR was literally struggling, and as always, there are lots of complaints. They showed research for us that across the globe now is, I think that's the delayed. A lot of companies were so slow and so careful for such a long time that now it's all boomed, you know. And in the US, there are 30% growth of the number of job positions available versus pre-COVID times, the same time, you know. And we see, as we talk here, you know, as Sylvia just mentioned, universality, exactly, as we see it across all of our countries. And now it's also the requirements in terms of hybrid work. It's getting more and more complicated. And obviously, which makes it even more and more interesting. So it's going to be very interesting times, I think. Well, interesting, not in the British sense, but in the good sense.
I think what was. Oh, sorry.
Yeah.
Oh no! What I was saying is, I think it's for Italy at least. It's been fascinating to see that pre-COVID, even you know, work remote or, you know, flexible working in terms of kind of hours or days in the office and things like that were absolutely unheard of.
Right.
And then COVID hit, and they're like, people work, they're happier. You know, even that flexible of saying maybe 2 days in the office and 3 days at home, or however they want. And I've seen that a lot of businesses are like, we want to keep our employees happy. We want to make sure that, you know, they're productive and they're satisfied with how they're doing the work. And it's been a huge shift for Italy, I think, from what I've seen.
Wow, fascinating. Irina, I'm just going to come to you really quickly. There's a couple of points in the chat. James Birchall, thank you very much for putting this in. I'd be interested in your opinion over the delays in containers arriving. Here in Spain, there are considerable delays which affect temporary accommodation extensions and or more demand for temporary furniture. And Marina Semenova has just replied, containers delay is very challenging. It's hard to explain that to clients. The white paper done by International Association of Movers does help to show that it's a worldwide problem. Have you got a comment, Irina? Oh, sorry, it's a phrase of the year. Yeah, you're on mute.
And now our meeting is properly handled.
Yay!
Thanks a lot, James, for mentioning that. It's on my list of the trends. It's I think one of the most painful in the household goods market, obviously. Not only the containers are delayed, at first they're not available. It's very hard to get to your turn. Then you pay literally at least double the price that we used to pay for them pre-COVID, and then they would be delayed, you know, and delayed. And obviously that hits the storage, the lack of storage, because people are, so that's a huge problem at the moment. And there is a lot, well, Marina mentioned that IAM is doing a lot of publicity about that, and we for us that's a huge support, because obviously our clients are unhappy. Not only do we pay you the double price, our shipment is delayed, you know, and at the moment, and all the transit times are delayed. At the moment, there is no light in the tunnel. It is what it is, because a lot of obviously, because of the pandemic, a lot of the lines were on hold, and a lot of the things got in the way. So now I think for us as a community, as a professional community, our job is to educate our clients, to manage their expectations, exactly as we're talking about the housing market.
Yeah.
That really affects our job, you know, and because it's I think EuRA and IAM are doing a lot of great things in cooperating also and informing each other, because relocation does not always understand the realities of the household goods, and the household goods people do not always understand the impact it has on the relocation, right? On temporary housing, on immigration, on things like that. So I think our job as the community is educate, and well, make this information available for our clients, you know, for us to help manage their expectations. So thank you a lot, James, for bringing that up.
Thank you indeed. Thank you, Irina. That's great. And we are, as I say, that, you know, what can we do as we're a broad church in this fantastic community of mobility, and communication is key. We're over time, and just want to thank everybody for attending today, but particularly to my fantastic panel. It's been a really terrific discussion. Thanks, Irina. Thanks, Jenny. Thanks, Pauline. Thanks, Patricia, for taking part. Really,
thank you, Dominic,
Thanks, Dom.
for inviting us.
With a glass of cava.
Yes.
Thank you
That's
so
all
much.
you have to say. That's all you have to say.
Thank you, everybody. Take care.
Thank you.
Thank you.
Bye.